Welcome to Module D. This is your last module for this course. The Module D goals include identifying written health, safety, and emergency procedures and practices. These may vary from school to school. Describing responsibilities and practices associated with maintaining the physical health and safety of our students. It will also discuss the obligations of all school personnel to report child abuse, any suicide concerns, or any other dangerous behaviors you may see. Confidentiality often is a challenging area to maintain for anyone working with children. The OPI Resource Guide for Administrators, Educators, and Paraeducators is a great resource regarding this topic. The role of the paraeducator is to provide support for education in the classroom. This takes many different forms: small group instruction, monitoring student activities, and providing behavioral support. It also involves providing health support. Paraeducators have typically worked either in a traditional classroom setting or in classrooms with students who have special needs, and many work as aides in school health rooms. Until recently, only school health aides and paraeducators in classrooms with students with special needs were faced with the possibility of providing medical services to students. As more and more students with multiple needs are included in daily educational settings, in traditional classrooms and into typical schools, all paraeducators and teachers are faced with the prospect of providing some sort of medical or physical support for some of their students. These services can range from very basic to extremely complex, intrusive procedures. Various school personnel maintain various roles and responsibilities in the areas of school health and safety. School mental health team members often serve as a resource specific to the mental health and emotional well-being of students. They often are the team members referred to when questions arise regarding abuse or neglect of children. As school personnel are increasingly required to perform medical procedures, concern arises regarding job descriptions and requirements, school conditions and available facilities, staff training and competencies, and liability, as well as the overall concern for providing a safe and healthy environment for all students. Court decisions have mandated that schools provide for many medical procedures. As a result, laws have been enacted that require the designation of personnel and specific training of those personnel in order to carry out procedures in a safe and appropriate manner. As you know from Module C, Maslow's hierarchy addresses the basic needs of children and the relationship for the basis of learning. Health and safety needs are key in this hierarchy. Choose one topic from your given list and post the key points from the topic you chose. Research shows that the risk of getting significant contagious diseases in a school setting is extremely small. Universal precautions means protecting oneself from exposure to blood or bodily fluids through the use of latex gloves, masks, or eye goggles. Cleaning blood or bodily fluid spills with soap and bleach solutions and water, and disinfecting and incinerating or decontaminating infected water before disposing of it in a sanitary landfill. The use of universal precautions reduces the risk of exposure to blood-borne pathogens that are a result of contact with blood and bodily fluids. Most school districts demand the use of universal precautions from their employees as a simple but highly reliable means of maintaining the health and safety of the employee. The school nurse will train paraeducators or educators, as well as giving them the right to deliver medication to students. When delivering medication, after having been given the appropriate training to do so, Triple check these 5 rights each time you give the medication. Protect their confidentiality and make sure that you have the right student. Do you have the right medication? Compare the prescribing practitioner's written instructions to the medication log and the pharmacy label. Check expiration dates. Do you have the right dosage? Be sure to give the exact amount of medication specified by the legal prescribing practitioner's orders and the pharmacy label. The dosage on the medication bottle and the authorization should agree. Do you have the right time? Check the medication log for the time when the medication should be given and to determine if it has already been given that day. Do you have the right route? Check the medication order and the pharmacy label for the method indicating the exact route for the medication to be given, for example, by mouth or by injection. Many students within the public school setting have some sort of seizure disorder. Typically, seizures are controlled with medication. There are, however, occasions when a student was not previously diagnosed with having seizures, or when medication is not effective and a seizure will occur. There are specific steps that should be followed in dealing with these situations. Lower the person to the floor. If in a wheelchair, unstrap feet and loosen other straps. Wait for assistance before removing them from the chair to the floor. Loosen tight clothing that might interfere with breathing. Time the seizure and make sure you are observing the physical movements. Place the person on their side to keep their airway open. Tip their head slightly forward if it is all possible and you think there may be an obstruction. Check for individual plan and school policy for how long seizures can continue before calling for emergency assistance. Document time and duration and describe as objectively as possible. Now that you have viewed the video demonstrating the Heimlich maneuver, let's discuss additional eating topics. Many students in special education settings need assistance with eating. This assistance may include reminders about table manners or actually feeding a student using a G-tube after having been appropriately trained from the school nurse. Many students need special assistance in following mealtime plans prescribed by specialists that may be quite complex and/or could deal with issues such as positioning the student at the table, special recommendations regarding placement of food, allergic responses, possibility of choking and consequent use of the Heimlich maneuver, and appropriate utensil use. No plastic utensils for students should ever be used because of bite reflexes or too strong of a bite and choking hazards. Paraeducators should always ask for pertinent information regarding a student's mealtime procedures if they are unfamiliar with the student and in the case that they will be physically assisting the student with the eating process. Any school district employee must report known or suspected abuse or neglect. Additional guidelines are included in your Moodle reference material as well as the link to the state website. Thank you for completing this course.